Hello, I'm Emily, one of the physiotherapists at the Neuromuscular Centre. So I'm presenting my presentation today, which is around dysphagia. So what we're going to cover, what the presentation is going to cover is definition of dysphagia, about what it is, common conditions that it can be seen in, and then we're going to go into a little bit of sort of the anatomy and the stages of swallowing, just to show where these issues can arise. Risks that are associated with dysphagia. And then we're going to look at a little bit sort of if you are having these problems, where we go from here. So about the assessment that you will usually have with the speech and language therapy team. Then a little bit about what can be done and implemented, what they may recommend for you. And then lastly, just a little bit of research. So dysphagia is the medical term for what we call swallowing difficulties. So people can have difficulties with different aspects of the swallow. So it may be that people are experiencing issues with swallowing just certain types of foods or liquids, so it can affect when having drinks also, or it could lead to, some people may experience being unable to swallow at all. So signs of dysphagia, so people often first recognise that they may be regularly coughing or having choking episodes when eating or drinking. So this will usually sort of happen slowly, so it may start being occasional and then more frequently noticing that you're having coughing episodes when eating or drinking. This could often lead to bringing food or drinks back up on occasion, so people may recognise that they're bringing drinks up through the nose. They may experience a sensation that food is stuck in the throat or chest. Maybe issues with saliva, so people could experience persistent drooling of saliva or feel like they're unable to manage their secretions, leading to choking on saliva. So there are more common conditions that we will see dysphagia issues in, but is not limited to just these. So the most common conditions would be IBM, inclusion body myositis, quite commonly seen in OPMD, which is oculopharyngeal muscular dystrophy, Duchenne muscular dystrophy, and myotonic dystrophy, but like I say, people may not have one of these specific conditions, but it can still arise in other conditions too. So just a little bit about swallowing. So it's often thought of like being a straightforward process that we don't really have to think about. One of those things that just happens until an issue arises. So it's actually one of the most complex processes that the human body performs, and it involves careful coordination between the brain and the muscles and nerves required for swallowing. So it is basically the movement of substances from the mouth or the oral cavity into the stomach. And so we have processing centres in the brain, and that involves many of the cranial nerves. So I won't go into too much detail about that, but yeah, it's quite a complex process and many areas of the brain need to work together. So as we said before, different aspects of the swallow can be affected. It's not a one size fits all. There could be different areas that people are having these problems in. So the first stage of swallowing is the oral phase, which is a voluntary process, so we control that. This is where the tongue collects the food or the drink ready for the food processing, which is so when we chew the food basically and try and make that food into the right size and texture ready to be swallowed. So when we're doing this, we're also mixing in saliva into the food, which moistens the food, making it easier to be swallowed. And during this movement, the movement of the jaw is coordinated with the tongue, the cheek, the soft palate and the hyoid bone. When we're mixing in the food with saliva as well, this is the first part of digestion because the saliva contains enzymes, so it's helping sort of that breakdown in the first stage. So the second stage we have here, so when the food is prepared to be swallowed, we call that the bolus of food. So when the bolus of food is ready for swallowing, it's placed on the tongue surface, and then the tongue moves in a certain way. The tongue tip rises to touch the hard palate in the mouth, which is just behind the upper teeth, and then the back of the tongue drops down to open the back of the oral cavity. So this is the tongue moving like upwards from front to back to squeeze the bolus of food back to along the palate and into the pharynx, ready for them being pushed down towards the stomach. And this is an autonomous process, so this isn't a voluntary movement that we control, like initiating the swallow. This is something that comes naturally. So the third stage is esophageal phase, and this is when the bolus of food is then progressing down towards the stomach. Again, this is not under voluntary control either. This is something that our body takes control of. And then this phase will end once that bolus of food passes through the lower esophageal sphincter and into the stomach. So I've put a video on here. It's just a nice way of showing how these three phases all work together. So I'm just going to start this from 40 seconds. Here we go.
The pharyngeal phase begins when receptors in the oral pharynx are stimulated. This triggers initiation of the swallow reflex, which is involuntary. This part of swallowing must be coordinated perfectly because the pharynx is the entrance to both the esophagus and the trachea. While the esophagus leads to the stomach, the trachea leads to the lungs. The vocal folds are located in the larynx, which is at the top of the trachea. The vocal cords close and the larynx gets pulled up as the epiglottis flips over the entrance to the trachea. The upper esophageal sphincter opens to allow the bolus to enter the esophagus. During the esophageal phase, food is propelled down the esophagus towards the stomach by waves of muscular contractions known as peristalsis. The larynx moves back down and the epiglottis flips back up so respiration can resume.
There we go. So that was a nice little video that just shows how those three stages link together to get food travelling from the mouth into the stomach and how it should work. So when issues arise with dysphagia, there are risks associated with this. So one of the main risks is obviously choking on the food. When this happens, something called aspiration can occur, and this is where, like it shows in the video, instead of food going down into the stomach, some can enter the lungs, and consequently this can also lead to aspiration pneumonia. So the bacteria builds in the lungs when food enters that in a choking episode. If people are regularly having issues with eating and drinking, it can also lead to dehydration and malnutrition. So they may struggle to maintain a healthy weight, and it can also lead to social anxiety and isolation. So if people are having issues when eating, they may feel uncomfortable eating around people or going out for food, which can have a knock-on effect also. In some situations, some people may experience weakened coughs also. So if your cough is weaker than what it should be, it may be harder for people to protect their airway, because in the event of a choking episode, it's hard to cough that food back up to prevent that from going down to the lungs. So we do something called the Sydney Swallow Questionnaire here at the NMC. So if you're having issues with swallowing at all, you can always talk to us, and then this is something that we may go through with you. So it's just a questionnaire, and if you can see here on the right hand side, question 1, for example, it's just your interpretation. So we'll ask you a series of questions with different issues that relate to dysphagia, and it's your interpretation. So we just ask you to draw a line on. So for example, if you're having no difficulty, you'd draw a line closer towards the left hand side, and if you felt like you were having more, then you'd draw your line further across. Once this is completed, if you hand it back to us, we will work it out and get you an overall score. And if this highlights an issue, then we may request an onward referral to the speech and language therapy department, and they may want to complete further investigation to find out what's going on. And so after this point, you may have a meeting with a member of the speech and language team who may want to conduct an assessment. So their first action would be trying to identify the risk of the dysphagia and aspiration. And they may start with just having a conversation with you and questioning you about what problems are being caused for you, if there's certain substances causing it, how frequent it is, how severe it is, and the onset of the symptoms. They may also want to have a look at your teeth, your lips, your jaw and your tongue, cheeks and soft palate, and they may ask you to do certain movements such as smacking your lips together, sticking your jaw out, showing them how you cough and how you'd clear your throat. They may then ask a series of, they may ask you to swallow a series of different samples of food and drink of different textures. For example, so some people struggle with more chewy foods or quite doughy foods like bread. They can find those harder to swallow. So they may try you on something and then see if you manage better with food in a different form. They will also take note if you have problems with chewing or swallowing or breathing whilst you're trying these samples, and if your voice sounds wet, because that can be a sign of aspiration. So follow-up tests. So if they're unable to pinpoint the cause during that initial assessment, they may refer you for other swallowing tests. So as you can see on this picture here, this is called a modified barium swallow test, otherwise known as a moving X-ray. So during this, it's basically like a live X-ray, and it watches the process of you swallowing some food, and they can see how it moves down towards the stomach. And so there's other tests as well, but I'm not going to go into those. But yes, if they need to do further investigations, they may also request other tests. So what can be done if we're having issues with swallowing? So it can be something simple where we just need education or some management tips to try and make things easier for you. Exercise prescription, so obviously with neuromuscular conditions being progressive often, so like we do in the gym, so if we put exercises in place quite early on, then that can slow down progression as well, or aim to slow down progression. And there's other things that can be adapted as well, so it can be changes to your diet, eating a softened diet, adding thickener to your drinks, and then sometimes as well people may also have a peg fitted, which we're going to go into a little bit later on. So management tips. it could be something simple like just having a 30-minute rest before you eat your meal, just making sure that we're resting ourselves and have the energy, because it can be quite strenuous if we have weakness with all the chewing involved and the swallowing. So having a rest can make a difference for some people. Making sure that we're sitting correctly, so that we're sat nice and upright, that your backrest is elevated, and sitting in a good 90-degree position as well can help whilst eating. So yeah, making those postural changes to improve swallowing. You can also adjust the feeding rate and the bite size during the meal. So if you find it takes you a bit longer, then that's okay. Then eat slower. Take your time with the chewing, make sure that bolus is ready to be swallowed. You might also find that it's beneficial to have smaller bite sizes as well, so cutting up the food a bit more just so it's easier to process. Taking regular drinks whilst eating, so it may be that you have a mouthful of food then followed by a drink to help wash it down. Varying the placement of the food in the mouth as well. There can be placing the food on certain areas which can make it easier for you to initiate that swallow, and sort of figuring out what works for you. So if there is certain like foods that you struggle with, or trialing different bite sizes and just figuring out what you can tolerate best. So you may be given some exercises to try and help maintain the strength of the muscles used in swallow. So I wouldn't advise doing any of these just yet, because there's different issues that can be that can go wrong as we've gone through, and you need to make sure that you're doing the correct exercise for your personal problem. So I would wait until you have seen the speech and language therapy team if you are referred, and they will advise you on the correct exercises for you. This is just an example of some that can be given. The link will open. Here we go. So yeah, this is one that the NHS provides. So this is for if somebody has a weakness of the base of the tongue, and it may be something simple like taking a breath and hold your breath lightly, then keeping your tongue in contact with the roof of your mouth as tightly as you can, and keep squeezing your throat as you swallow, then forcibly exhale. So, and they advise of how often that you need to be doing this. Some more examples. So we have here, just move this out of the way. So there's different sections on this one. So it may be for working certain muscles. It may be airway protection exercises, and just give some examples of those there. Base of the tongue exercises, so we've got things like the effortful swallow, or things like yawning. It could be if we have jaw weakness, then there's some examples of some exercises there. But like I say, I'd wait to see what's recommended for you by the speech and language therapy team. So there is a framework that's quite often followed by medical professionals, and this is just how we sort of differentiate from different dietary adaptations. So it could be foods. So we start here at level 7, which are easy to chew foods. Then if we're still struggling at level 7, we can move down to soft and bite-sized pieces. Again, we can then progress that to minced and moist if we're still having problems. And then again onto pureed, a picture there for an example. And again, we can alter how thick the drinks are. So we're going to have a look at that on the next slide, but there's something that we can get called thickener, which we add to drinks, which change the thickness. So you can start with thin drinks, level 0, which is just your usual liquids. You can then go to slightly thick, then mildly thick and moderately thick, too extremely thick, which you can see on the picture on your right, an example. So this is one example of a thickener that can be prescribed called Thicken Up, and it's a powder that you add to your drink before consumption. So the idea of this is thickened fluids move slower than thin fluids in that swallowing process, so it gives your body more time to protect the airway. The speech and language team will probably try different drinks with you and let you know which level they recommend. But basically, the thicker that you require your drink, the more scoops of thickener you add each time. But there will be instructions and they'll provide you with all information about that. So on occasion, people may be recommended to have a PEG, which is a percutaneous endoscopic gastrostomy, if I can get my words out. So this is a surgically placed tube that allows you to get direct nutrition directly to the stomach. So some people assume that just because you have a PEG fitted that you then are unable to eat food. So that is wrong. You are still able to eat and drink if you'd like to. So if you're having trouble eating the recommended amount and you find that you're losing weight because it's just hard with the effort of eating and drinking, so it may be advised just to make sure that you're getting the recommended amount of calories, the recommended amount of fluid to keep you healthy. And then it may just be that you decide that you want to still have some tasters or just eat when you feel like it on top of that, but you haven't got that worry of making sure that you eat enough or fatiguing as well if it's taking you a long time. So again, this method is usually recommended when a person has an inadequate oral intake or requires nutritional support to meet the body's metabolic requirements. You can also have medication given through a PEG also, if that is an issue for you. So finally, just a little bit of research, so don't worry too much about this. This is just an example of quite a complicated algorithm designed for managing dysphagia in Duchenne patients. So it's a tool quite often used by medical professionals to help them choose what course of action to follow. So it just shows that, for example, in the bottom right-hand corner, it may start with something simple, just like mealtime strategies. So a little bit more research. So this was conducted around IBM. So it was a paper conducted looking into the management challenges of patients with IBM experiencing dysphagia, and overall it basically just concludes that more research needs to be done about the topic, and it emphasises that screening and early diagnosis are very important for the best treatment. So the implementation of exercise quite early on is shown to have an effect as well. And it is also important in, like we said earlier, in trying to slow down that progress of the issue. It also says that it's vital to keep screening for swallowing issues regularly at appointments. And there's just some references that we used to make this presentation. So thank you for watching the presentation. So I would definitely recommend not trying the exercises if you are having issues, until you have seen the speech and language therapy team. So obviously I'm not a specialist in the subject. This is just information that I've gained from doing some research or by speaking to people. So just the whole idea is just to give you a bit of an example of sort of if you're having this problem, what can be done to help you and where to go from here. But do feel free, if you're having any issues with swallowing, to talk to one of us at the Neuromuscular Centre, and we can complete that Sydney Swallow questionnaire, which will give us an idea of what you're struggling with and how much, and then we can get that referral put in place for in the future for you. Thank you very much for watching. Bye.